later, but welcome.
Thank you.
Thank you so much for joining us.
And thank you very much for inviting me. It's lovely to see you here, Lakia and KW. My name is Lora Ruth Wogu. I'm representing Sickle Cell and Thalassaemia Ireland, COO of the European Sickle Cell Federation, and also founding member of the Pan-African Sickle Cell Federation. So I'm here to talk about Ireland, which is Sickle Cell and Thalassaemia Ireland. Thank you so much for inviting me. So I think you wanted me to share about advocacy in Dublin, in the Republic of Ireland. And the organization was founded in 2011 after a bit of research for the 2 years between 2008 to 2010, and then registered officially as a charity, as a company limited by guarantee without shares in 2012, and then received our charitable status a year later, which is 2013. So we've been campaigning to raise awareness because that was lacking, and the numbers of patients with sickle cell disease were rising significantly. There was no support. There was a lot of stigma that people could not talk about sickle cell, and nobody really understood. So nobody knew about it. My becoming involved in raising awareness was due to my work, which I work in the university hospital as an allied healthcare professional, working in the laboratories, as well as phlebotomy, taking blood samples from patients. So that's how I met a lot of patients, adult patients coming to the hospital, and I got very interested in the disease, started searching about it, and decided to found the organization. So our advocacy work began by us linking ourselves to the hospital, which was the Children's Hospital, to make sure that we are connected with the clinicians, but at the same time, we are connected with the patients. That way we can provide more support to the patients and the families, but at the same time, can use the expertise of the clinicians to raise awareness, which the relationship has worked very well for the last few years. And we still have those clinicians as our medical advisors. Now, it wasn't easy. The first years were very difficult. We are not funded by the government yet, and that's what we are working on, to get sickle cell recognized as a public health priority in Ireland, and also start funding the charity so that we can employ people. So I must say that we have about between 15 to 20 volunteers who are volunteering for the organization, but at the same time, we have people who come in to volunteer on just temporary basis, maybe if we are having a marathon or things like that. So we have a lot of volunteers, and all of them, because they are passionate, they don't get paid. I don't get paid for being the CEO or founding the organization. I have had to put in my own finances at some stage, but luckily, because of the work we do, we have been able to receive funding from various companies, from various expertise, and various clinicians who saw the work we are doing, and that has helped us to last for the last 11 years. Now, our campaign, the first campaign we worked on was the newborn screening, which is a major need in Europe and in Ireland. And we ended up going to the Parliament of Ireland with a request to have newborn screening for all as a universal screening, including the Caucasian. And also our other campaign was on getting patients with sickle cell recognized as people who need the disability allowance, which is a weekly payment, and also people who need a medical card, which allows them to acquire health services without paying for anything, as well as expanding education into the curriculum of medical and nursing staff, so that when people graduate, the doctors and the nurses graduate, they are very, very aware of sickle cell disease and can treat patients with expertise from their studies. And also requested that we would get support so that we can provide more support to the patients, as well as the fact that we didn't have for patients with sickle cell. So most of the adult patients who are going into various university hospitals for services, and they were going to clinicians who didn't understand sickle cell at all. And that was a problem because sometimes those clinicians had to talk to the expert in the pediatric service to provide them with guidelines on how to treat an adult patient. So that was a problem. So anyway, we campaigned. Those were about 5 reasons we took to the parliament and requested for. To go to the parliament, I represented the patient organization. Then we had the Professor McMahon, who is the expert lead for cell for pediatrics. Had one of the clinicians from the adult hospital who came in as her name was Aileen Conneely. He's the consultant for hematology, but not specific to sickle cell. So we went to the parliament and requested for these services. That was in 2014, April the 10th. If you Google that, you would find the record there. But what happened, what was good with that is that regardless of the fact that we did not receive everything that we requested for, a year later, we were able to receive the adult center was set up, which was in 2015, November. That was a great achievement because then it meant that all the adult patients who are going in various hospitals can now go to one center and be looked after by an expert clinician in sickle cell. And they created a team, psychologist, social worker, the whole team to look after them. So that was an achievement. The second achievement was that the medical card, which allowed patients to access healthcare services without paying for anything, that was agreed upon. And so all sickle cell patients and thalassemia patients are able to attend any healthcare service. They can go to any pharmacy and get their medication without paying any charge. And they can also attend the emergency department without paying for any charge, as long as you're a sickle cell patient and you are listed and you have the number for the medical card, as well as being a resident in the country. You have to be a resident in the country. And then those are 2 achievements. The second achievement from medical cards was the support that we could provide. However, that is still ongoing, and the newborn screening is still ongoing. But at the same time, patients are able to receive the weekly pay, which helps them for disability. That was the third one, the disability allowance for patients with sickle cell. So sickle cell patients can apply for disability allowance, which would be about €203 a week. And that helps them to have something to live on. And at the same time, they have a card for free transport. So if somebody doesn't drive, they can take the bus. So that is free travel card. They can take the bus, the bus anywhere or train for free. And at the same time, if they are driving, they are given a fuel allowance, a small fuel allowance. So that is also helpful. So we feel that those are achievements, but we still have a long way to go in that we still have to campaign for the newborn screening to be recognized. And as well as that, we still have to work on policies and to ensure that the organization is recognized and sickle cell is recognized as a public health priority, and we get funding to employ staff. But we are still doing well. We are expanding, and we have now joined in the research area, whereby the organization has now become a member of the Health Research Charities Island, and we are embarking on starting our first research, which will be in mental health in sickle cell disease, which is going to be a partnership with the European Sickle Cell Federation. And we have our call for that research, which allows us to have up to 300,000 given to us from the Health Research Board. And then we contribute just a small bit, maybe 25% of that. So advocacy is good. Awareness is going great. We provide awareness sessions to healthcare providers, the ambulance personnel, medical students in the UCD, and also in schools. We are called upon whenever a teacher doesn't understand what the patient needs in school. We are there to go and educate them. So yeah, advocacy has been great, and the stigma is actually decreasing. It's not eliminated, but it's decreasing from 10 years ago, whereby nobody wanted to talk about sickle cell. But now people are willing. Our community is willing to talk about sickle cell. Our community is willing to participate in sickle cell events. And that is an achievement that wasn't there before. So as far as I can see, I think advocacy, as long as you continue to raise awareness and you put it out there, eventually that stigma goes away. But at the same time, there is need for collaboration. And this is a positive thing, because recently we just received a grant which allows us to expand our awareness to the Northern Republic of Ireland. And Northern Republic of Ireland is part of the UK, but unfortunately they don't benefit from the Sickle Cell Society or all other organizations in the UK, so they are left on their own. So we are going to be providing the awareness services to Northern Ireland. So I think that potential for Sickle Cell and Thalassaemia Ireland to develop further is great. And at the same time, Sickle Cell and Thalassaemia Ireland was able to expand and develop a trading name, which built out the Pan-African Sickle Cell Federation for Africa. So expanding internationally on a global level is also something that we've done and we are continuing to support, and also being part of the founding members of the European Sickle Cell Federation. So our focus is to ensure that we unite, we collaborate, and we work with everybody to make sure that sickle cell is seen. The landscape of sickle cell is about us working together to push policy for sickle cell disease, eliminate stigma, and eliminate the racial disparities that we are getting. Patients need to be heard, and we look forward to working with you, Agnes, and with Aska, and we look forward to working with everybody. So thank you for giving me this time. Thank you.
Thank you so much, Laura, for that informative session. It seems like you've really done a good job, and since 2013, and here we are. It gives us hope to see that we only started officially about 3 years ago. The challenges that you had to endure, and seeing the positive things that are coming through, that's something that we can all learn from and also try to emulate in Australia. Just one question though, what sort of numbers are we looking at? Do you have a registry to know how many patients are affected by sickle cell in Ireland?
Now, there is no concrete numbers because there is lack of registry in Ireland. However, based on those that attend the hospital, in the children's section, by 2009, they had 409 patients. But of course, as you know, those were the boom years whereby we were all coming and we are having children, migration is changing, the numbers could rise. And at the same time, the young ones are growing and going into teenage years, so they are moving into the adult services. So currently, it is estimated that we have about 903 patients in Ireland, but it could well be over 1,000, for the fact that just recently I received a request from the president of the Pan-African Sickle Cell Federation in Nigeria, saying that they sent one of her members has traveled to Ireland to study, and she's a sickle cell patient, so that I can provide help with that patient. So she's not registered in the hospital yet. And also, just a few months ago, I received a call again from somebody who came from Uganda to study in Ireland, a master's, and is a sickle cell patient. So when we are getting people who are just coming in as sickle cell patients, they are not in the register yet. So that's why I'm saying that register numbers could be higher, but for those that we know, it's about 800. Over 800 patients or 900 patients if you add them all together, but they could be much more higher than that.
So is there like any clear-cut data registry that is collecting that data? I'm looking at this from the Australian point of view, very similar in terms of the numbers as well. That happens as well. You know, if you are an international student, you know, it's not always that, especially adults visit the hospital to be in the hospital system. What we've heard from the doctors is, you know, people just go to the hospital once they have a crisis. And some of them are even treating themselves at home. We had a sickle cell warrior a few years ago who told us that, you know, she was pregnant and she never took anything. And she told the doctors that she was a sickle cell patient, and they started panicking, but she wasn't part of the hospital system. So we do have those, and Australia is big in terms of international students here, and the numbers are very similar. We also have about 1,000. That's just an estimate, but we have a lot of undocumented patients as well. Talking about like the healthcare system, that's something that you know is very encouraging to us as well, that you've managed to get special disability services for people living with sickle cell disease. For us, we have a disability scheme as well, and sickle cell disease is not part of that. So that's Team ASCA. That's a challenge for us to also try, which we call NDIS. But can you try to explain how do you define somebody who gets that special disability services?
Okay, so it's actually not only Australia that is struggling with that, because I just realized we've been working on this for Europe as well. Some countries in Europe don't have that. In Ireland, for you to qualify for disability allowance, you have to show that your daily life is affected, in that you can't fully perform duties as a normal person would. For example, if it is about working, you really can't sustain working a full week of 37 hours, because 37 hours in Ireland is the amount of hours that they call full-time hours. So you have to prove that. But the process is not so difficult, in that if you are already a patient that attends the service as a sickle cell patient, you have your general practitioner that you go to every week. When you're given the form, all you need to do is go to the clinic, they write the letter, but it depends also on the type of sickle cell. Although to me, I've seen most of every sickle cell patient receiving that benefit, because it's calculated that they have to get it anyway. But it's all about your GP writing, filling in the form and saying that you can't really perform and do normal duties like any other normal person. And also the clinic that you attend, the hematologist also giving the same letter saying the same thing, and then you fill in the form, and that's it. Then they get they get the payment. I think it's because we already campaigned for that and did not specify that the person has to be fully blown sickle cell, or somebody that has, my apologies in saying fully blown sickle cell, because that makes no sense. But as saying that somebody gets a crisis 3 times a year, because there are people who get a crisis once a year and those who get a crisis 3 times a year. They are still all patients. They are still sickle cell patients. So if you're campaigning, you have to campaign for the whole of sickle cell, not to say that one person is more sickle cell and the other one is not, just based on how the disease affects them. And I think that's what helped us in campaigning for that.
That's very,
But
very encouraging. Yeah.
At the same time, it's a choice, Agnes. Some patients don't want to be called disabled. They don't want to have that word disability on them, so they don't bother claiming for it. If they feel they can work, they don't bother claiming for it. But at the same time, having that benefit helps you, because you're still allowed to work 18.5 hours, which is half of 37 hours. So they are still allowed to work and earn up to 335 euros. If they earn more than that, then they may lose half of their benefit. But if you earn up to 335 euros, then you still get the benefit of 203, making up over 500 euro a week, and still have your travel allowance and your fuel allowance. So I think it works out well for patients. Like I said, some of them don't want the word disability on them, so they may not claim it.
No, it's just again, it's a catch-22. Yeah, you've said it right there, but also encouraging for some that genuinely need it. I remember one of the discussions we have, Caroline Picamezo here. She's one of our sickle cell warriors. She talked about, you know, trying to access the super early because there's the ages. I don't know whether you have like an insurance scheme for after you retire. I don't know what you call it in Ireland. Here we call it superannuation benefits. It's got an age, minimum age for you to access that. And I think Caroline pointed out that how can they allow people with sickle cell disease or maybe those with chronic illness to try to access. There is ways around it, but it's very complicated, but maybe making it easy. The session is supposed to finish around about now. I'll give chance to others who want to ask Lora any questions. But to start off, I've got a question in the chat box what's the population of Ireland? That's one of the questions.
The Irish population has grown. I was doing my BS in health management, and we say the population was about 4.9 million, but I think it is going up to 6 million due to the migration. So it's growing fast. And we've had a lot of people leaving UK since UK had Brexit. So people coming to Ireland. So the population is growing high. So we might be about up to 6 million. I'm not very sure, but I know that in 2018, it was about 4.6 million.
Agnes, can I add some content to that question?
Yes, please.
Yes.
Okay,
KW.
so the guidelines I understand is that you should have a hematologist for every 100,000 people living in your jurisdiction. The question about the population is really to ask how many hematologists, and I want to specify benign hematology as well, because I mean, I understand all hematologists should be straddling both. Most prefer to deal with malignant hematology because benign hematology is a lot more tricky. It's not easy to really work with. So I just wanted to find out if you all have your proper slate of hematologists based on that guide of one hematologist per 100,000.
Thank you very much for that question, KW. It is something that actually we are struggling with here. I know that I had a meeting with the expert clinician, Dr. McMahon, last year, and they were looking for another hematologist because she was complaining about the same thing. The numbers of children were growing, and she's the only hematologist. So I believe that the health service hematologist, but they still need another clinical specialist. So I would say we have only 3 expert hematologists in sickle cell. The adult center has only 1, but she's working with some registrars who are helping, but they are not really specified in sickle cell. And the children's hospital has 2. So we are still lacking in that area in getting expert clinicians in sickle cell, unfortunately.
Does anyone have any other questions before we finish? Sorry, KW, did you have the last question? I just want to give chance to others.
I'm good.
Anyone else has any question, please raise your hand. Looks like everybody's content. Well, KW, if you want to ask the last question, you can go ahead before we close. Thank you.
No, I just wanted to wish Lora all the best with the engagement of getting a hematologist. I just wanted to remind as well that the situation seems to be a global scenario where we have a lack of hematologists to deal with us properly. And I just want to remind that someone who really enjoys, as Dr. Sokov, Rob, I can't remember his last name, but he talks about being interested in hematology from a benign perspective is very important, because if someone tells you they're hematologist qualified and there's no interest in benign hematology, the difficulty for treating us exists. In Trinidad and Tobago, we have 4 different blood disorders: vulnerable hemophilia, thalassaemia, and sickle cell disease. And the hematologists that really focus in those areas are the ones that we get the best treatment from. And the one who was the best, Dr. Charles, speaking along with us. So I just want to encourage everybody sitting here to remember that when you engage a hematologist, you need to really figure out where the interest lies. Being a hematologist doesn't really give you the full journey into it. Thank you.
Yeah, exactly. I agree. But I also think that it's upon us now to show people that sickle cell is good. It is an area that they can benefit on. I mean, the medical professionals, because a lot of them don't want to spend specify in sickle cell or thalassemia or hemoglobinopathies, I must say, they look at cancer because they feel that there is more money in cancer and in other areas. So sickle cell is lacking for mainly that reason. So we need to show that we also need people to specify or to create their specialties in hemoglobinopathies. So we need clinical hematologists that understand the disease as well.
Yeah, Natalia
Maybe
said that Dr. Rob Sokolik spoke about that in our last Amplify Sickle Cell Voices.
yeah.
Yeah. Well, Isabella, do you have anything to say?
Let me just, can you hear me?
Yes.
Okay, that's good. Thank you, Laura, for coming on board and sharing your I guess your knowledge of this fight that we're in at the moment in advocacy and getting something going so that it's helping, with helping others.
Yes.
I really appreciate your talk. Thank you very much.
Thank you. Thank you for having me.
Well, that's a wrap, people, for the day. We started off at 9 o'clock. Some of us woke up at 2. Almost 12 hours up. But Laura, thank you so much for joining us. And we had a very good discussion with Dr. Bailey. We are here to create a global force together and see how we can change the face of sickle cell disease globally. So thank you so much for your insightful presentation. We can learn from what's happening from different parts of the world. And we know we do this for us to learn from other countries because we're a young country in terms of our advocacy work, but we've done so much, and it's through different organizations like yours that drives us as well. So thank you so much for joining us, and you are doing a good job globally. And yes, we're so glad that you managed to join us. Thank you so much.
I must say, Agnes, you're doing great work and you have such drive that inspires many as well. So I commend you for your tenacity and resilience in all the struggles. You still push on. So to see that you're doing a conference at this time in Melbourne, you need your sleep, but you're still doing this. So well done with your team. I know only Natalie Kapuya, but well done too. And I'm glad to have been invited to this. And I look forward to working with you in future. Thanks everyone for having me.
We have Isabella, the one who just spoke before. She's in Queensland.
Very good.
And we have Caroline, who's also here. She's in Western Australia.
Hello.
That's our team who's stay up. The other one who's named Agnes might be Mweo, I'm not sure. Because we just keep using each one's Zoom accounts, but I think 5 of us are on this, and we've been planning this from the beginning. So we are so glad it's actually come to the end, and with your support and other organization and presenters. We are back tomorrow. We are starting off at 9 o'clock. Tomorrow we are finishing at 8:30. We have a fantastic group as well joining us from across the world again. So please join us in a few hours. Thank you so much, Laura.
Isabella, is it you yawning?
It actually is. I am so tired.
Well done, Isabella. Well done.
I don't know how Agnes does it. You don't want to see
my face right now. Okay, I'll come up, but you don't want to see
you should. You should come up. There she is.
God.
Look at her.
Look at me.
You look gorgeous.
Thank you.
Look, she looks gorgeous.
You look okay, Agnes.
Oh, look at that.
I look forward to seeing you for the
Hey, Laura.
Sickle Cell one as well.
Oh, yes, we are joining you definitely. So you are at work, so you gown up as well, right?
Well, yeah, I have to. Thank you so much.
Thank you, Laura.
All right,
it was
take
great.
care.
Bye.
All right, thanks.
Okay.
Thank you.
Just got a screenshot. All right.
Oh, can I get a screenshot?
Bye, guys.
Thanks. Print screen. There you go.
Did you? I was biting my
No, I just did it. I just did it. Just wait. Don't go yet, just in case it didn't turn out. I'm just going to paste it. Let's see. Oh, look at that. Everyone was smiling. Very good. Okay.
Yeah.
Thank you so much, Sweden, Trinidad and Tobago. Mr. Muhammad, where are you joining us from? Actually in Cameroon. Mr. Muhammad something. I don't know whether it's Muhammad. Muhammad, I know this name. I think it's, were you on
Shahala.
before, I think? Oman?
I think it's been a few times, yeah.
Yeah, Oman. Yeah, because Mr. Mustafa is coming as Morocco. I think Oman.
He's
Anyway,
from Saudi Arabia.
for Saudi Arabia. Yes, yes. Well, thank you so much
Mm.
for joining us, guys. Let's go and have a sleep. We still have one more day.